Arguably, the greatest risk to human health comes in the form of antibiotic-resistant bacteria.
Imagine this, right? So you have a plant that is in the ground and you treat that plant with antibiotics. That antibiotic can end up in the fruit itself, in which you can eat. You are exposed to it.
If I have a sick animal and I treat it with antibiotics, the antibiotic residue will end up in its dropping. If tomorrow that manure is then taken to grow flowers or maize or beans or mboga, what have we done? We've simply contaminated that farm with antibiotic residue.
You take antibiotics, we go to the toilet.
If I have drugs that have expired, a good chunk will tell you they throw it in the toilet.
What do you do when you don't finish your antibiotic? Where do you throw that? You throw it in the bin, which then ends up in the environment.
When you end up with that mboga that has been grown with that manure or that antibiotic that has come through the dustbin or the toilet, so what happens when you eat it? You're eating antibiotic residues, but you're also eating organisms that are resistant to the antibiotic. Close to 70% of antibiotics actually goes to farming animals. A lot of us have not got the connection between how we raise animals and how we transport animals and ultimately slaughter them and the use of antibiotics. Whatever you feed the animal has the capacity to concentrate it and give it back to you on your plate. 50 to 60% of antibiotics going into farm animals is actually not necessary. If the animal is not slaughtered humanely, either it is stressed. That stress means if it already had bacteria within itself, too much stress will depress the animal immune system and the bacteria will flare, so you end up with a product that's already contaminated. Alternatively, if the animal gets injured or bruised, the bruised part needs to be sliced off because it's part where you can have bacterial contamination.
I sit in the lab every day in the morning. I see at least 50% of the organisms I am reporting, they are resistant at least to 2 antibiotics, 3 antibiotics. And some of the patients we have exhausted all antibiotics.
The scariest thing is that I am not sure that in 5–10 years we'll have antibiotics to use to treat humanity, unless we change our ways. We are in a country where I can wake up in the morning and go to a pharmacist and buy an antibiotic, which is supposedly a prescription-only medication.
Right now, to produce a drug costs literally $3 to $4 or more billion for pharma. You might succeed, it may not succeed. And if you are so lucky to succeed, that drug will be used by a very relatively small number of people and probably only once in their life. So pharma is not really into making drugs like antibiotics.
We have no clue how much resistance, how many patients in my ICU are dying because of an anaerobic infection, I don't know.
We are in a state we don't have data, we don't know the level of AMR, we don't know how to manage our patients. I think it's a very sad state of affairs. We are mostly unprepared. So it's not uncommon, it's not imaginary, it's not just a story. It's reality.
If we want to challenge AMR, we also have to consider sanitation. We also have to consider poverty or livelihood, and we have to be, I think, honest about those discussions.